Hi, I'm Glenn Pearson, and I'm hosting today's flash interview for ACO Exhibit Hall. And I'd like to welcome Dr. James Fee, who is CEO of a company called Enjoin. They provide clinical documentation integrity services for ACOs. So welcome to our audience. Welcome to Dr. Fee. Dr. Fee, what services do you provide for ACOs?
I think the best way to sum it up is really to lie the perspective to where ACOs are today. Certainly outside of COVID-19 waivers, ACOs face a challenge of really population accounting, and that is forecasting the future expenditures as well as reconciling, if you may, the current ones. And so we know that the chronic disease burden of a population really drives a lot of that cost and expenditure toward a benchmark. So what Enjoin does is we offer solutions to ensure that the ACO's population is truly reflected in the documentation and coding. So we look at really our expertise and focus is translating the clinical care of the patient through that documentation and coding such that evidence-based care coordination is achieved, appropriate resource utilization, and improved patient outcomes.
Great. Now I've talked to several other companies that provide what appear to be parallel services. What do you offer specifically that makes you unique that should have an ACO consider working with you?
Sure. I think what specifically is unique to us is the team that we have amassed. It's not necessarily, it's more how we do it, I guess you could say. We have practicing physicians who have built programs around appropriate and accurate documentation and coding and able to live and share that, so we partner. So what we do is we bring that unique combination of physician expertise, clinical expertise, and coding expertise. We do that through operations, partnering with organizations to ensure that the care is accurately translated. We do that through chart review process. Many are familiar with the pre-visit planning process, and we also do that through a transfer of knowledge through education. So through our program, we have been effective in doing this with identifying 44% average HCC opportunity, allowing for plans to have a potential impact of $17 million. The key thing about our pre-visit planning is that we align the right patients with the right physicians at the right time for the right diagnoses. So we're also, as physicians, we're addressing or eliminating the potential for physician burnout.
So it sounds like you have a lot of clinical depth and a very thorough process. So that's important to have people consider working with you for that. That's great. I appreciate your information. And for the listeners, if you want more information on Enjoin, you can visit their booth at ACO Exhibit Hall. And before I sign off, I wanted to just mention that I had a book that might be of some interest to viewers and listeners. It's called Thriving the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. And you'll see the HIMSS logos on the front cover, which I'm very proud of. But what I do in the book is I identify 84 pitfalls that I've seen trip up vendors selling their products into healthcare and provide about 200 suggestions for how to avoid those. So it's available on Amazon. Check it out and come back next time for the next flash interview with ACO Exhibit Hall. Thanks so much.
Thank you.